guys, so this is IV Piggyback. So I already have my primary medicine hanging up because this is about my third time doing this video. All of my videos have not had audio, so we're gonna try again. So I already have my primary one hanging up. So when you first go to do your piggyback, you need to check your medical order, check for right patient, right route, right dose, right medication, check for all of those rights and make sure that you're doing what you're supposed to be doing. After that, you're going to check your compatibility chart and the compatibility of the two medicines. You need to check a compatibility chart. You need to check a drug guide or a reliable source, or you can call the pharmacy and see if it's compatible. Alright, then after that, you are going to calculate your manual drop factor. So the order in the scenario read 1 gram of Ancef per, and it's 125 milliliters, and so it's every 4 hours over 1 hour. So we know that our drop factor is 10 because it says it right here. So you would do 125 times 10 divided by 60, which gives you 20.8, and you cannot do 20.8 drops per minute, so that will go up to 21 drops per minute. Alright, so after you've done your calculation, I already got this hung up and everything, so I would open this up, spike this, and I would start I would close it before I even put this in here because we don't need a mess. But I would prime my tubing. You just want to let it drip. Get the drip chamber handle full. Alright, there we go. Some of it dripped out. Now you want to do the same thing to the secondary mix. Take this out, discard this, and you want to take out your tubes for this. So we're going to pop this. We would take something off of this, and we would remain, what's that word? Sterile, will remain sterile. Alright. So we make sure this is closed too because we don't want anything dripping out. I'll hang this. And then I would prime this one too. Yep, there we go. Some of it dripped out. Alright. Now, taking this off. Walk into my patient's room, I'm going to knock on my patient's door, and I'm going to identify my patient using their name, date of birth, verify that with the armband. I'm going to introduce myself. Hi, I'm Nurse Brittany, and I'm taking care of you today. Next, I'm going to explain the procedure to them, what I'm doing, and the most important thing is to ask about allergies because there is no turnaround time when you do IV medications, so we need to make sure that they're not allergic. Alright. So we're in our patient's room. We've identified everything and checked for allergies. Now it is time to hang our medicine, but before we do that, we need to perform hand hygiene. Alright. So after performing hand hygiene, we are going to hang our medication. So we're going to hang secondary medication normally. We have this extension hook for piggyback. So take this off the normal hook, put it like this, and let this hang. I hope y'all can see that. I have it hanging on the blue hook. Alright, after it's hanging, we want to take our alcohol pad, get this, that is, say, connected to the patient. We are going to clean this port for 30 seconds in a circular motion. Make sure not to contaminate it. We also want to take this off. You want to clean this too, because you can never clean too much. 30 seconds with the alcohol prep pad. Alright. Now let's connect these two. They are connected. So as I mentioned earlier, I got the calculation. After I did my calculation from the scenario, I got 21 drops per minute. So that's what I would manually set this to. I would set this to 21 drops per minute. So after that is done, say this is empty now, and we have to discontinue this piggyback. We're going to make sure this is closed, make sure all the valves are closed. We're going to undo it. I'm going to pick this up, set it down. We're going to take this off of the extension hood because we do not need that anymore. Put that in the pile to throw away. Put this up here. And at this point, we're going to get our nifty regulator clamp, and we're going to set this back to the original ordered drops per minute. Say the original drops per minute was 23. So I would set this to 23. That's just a random number just for examples. Alright, so after I set that on the patient, I just need to make sure they are comfortable and all fixed up, good to go. I would dispose of this according to facility policy. Dispose. Then I would just document on the MAR the time administered, my initials, and the date.